Question 1. A nurse is caring for a patient diagnosed with narcolepsy. Which intervention is the priority for ensuring patient safety? A. Encourage daytime naps. B. Teach the patient to avoid alcohol and caffeine. C. Recommend participation in support groups. D. Implement fall precautions. Answer: D. Implement fall precautions. Question 2. A patient with narcolepsy is prescribed modafinil. What should the nurse include in the teaching? A. Take this medication at bedtime to improve sleep quality. B. This medication will completely cure your condition. C. Avoid driving until you understand how this medication affects you. D. Stop taking the medication if you feel drowsy. Answer: C. Avoid driving until you understand how this medication affects you. Question 3. Which symptoms should the nurse prioritize when assessing a patient with narcolepsy? A. Insomnia. B. Sudden muscle weakness, cataplexy. C. Sleepwalking. D. Nightmares. Answer: B. Sudden muscle weakness, cataplexy. Question 4. The nurse is educating a patient with narcolepsy about lifestyle modifications. Which statement indicates a need for further teaching? A. I will take short scheduled naps during the day. B. I should drink alcohol in moderation. C. I need to maintain a consistent sleep schedule. D. Regular exercise may help manage my symptoms. Answer: B. I should drink alcohol in moderation. Question 5. A nurse delegates care to an unlicensed assistive personnel, UAP, for a patient with narcolepsy. Which task is appropriate to delegate? A. Teaching a patient about scheduled naps. B. Monitoring the patient for sudden falls. C. Assisting the patient with ambulation. D. Adjusting the patient's medication schedule. Answer: C. Assisting the patient with ambulation. Question 6. A patient with narcolepsy reports experiencing cataplexy episodes. What is the best initial nursing action? A. Teach the patient to lie down when an episode starts. B. Administer an as-needed stimulant medication. C. Recommend avoiding strong emotions that trigger episodes. D. Notify the healthcare provider immediately. Answer: A. Teach the patient to lie down when an episode starts. Question 7. The nurse is providing discharge teaching to a patient with narcolepsy. Which statement by the patient requires correction? A. I will take my prescribed stimulant medication in the morning. B. I should establish a bedtime routine and avoid naps. C. I will avoid driving unless cleared by my provider. D. Caffeine may help me stay awake, but I should use it cautiously. Answer: B. I should establish a bedtime routine and avoid naps. Question 8. The nurse is assessing a patient with narcolepsy. Which finding requires immediate intervention? A. The patient falls asleep while eating. B. The patient reports excessive daytime sleepiness. C. The patient experiences brief hallucinations before falling asleep. D. The patient describes having vivid dreams. Answer: A. The patient falls asleep while eating. Question 9. Which nursing intervention is most important for a hospitalized patient with narcolepsy? A. Administering sedatives at bedtime. B. Allowing the patient to skip meals if tired. C. Encouraging frequent position changes. D. Ensuring a safe environment to prevent injury. Answer: D. Ensuring a safe environment to prevent injury. Question 10. The nurse is teaching a newly diagnosed narcoleptic patient about lifestyle changes. Which strategy is most effective in managing daytime sleepiness? A. Drinking more caffeine. B. Taking scheduled daytime naps. C. Taking a sleeping pill at night. D. Increasing television watching at night. Answer: B. Taking scheduled daytime naps. Question 11. A patient with narcolepsy has been prescribed sodium oxybate. What is the most important teaching point? A. Take this medication with food to prevent nausea. B. Do not engage in activities requiring alertness until the effects are known. C. This medication should be taken in the morning. D. Avoid all dairy products while taking this medication. Answer: B. Do not engage in activities requiring alertness until the effects are known. Question 12. The nurse identifies which priority goal for a patient with narcolepsy? A. Preventing injury from falls. B. Eliminating all daytime sleep episodes. C. Avoiding social interactions. D. Encouraging longer nighttime sleep. Answer: A. Preventing injury from falls. Question 13. A nurse is counseling a patient with narcolepsy on avoiding triggers for cataplexy. Which statement by the patient indicates a need for further teaching? A. I should avoid stressful situations. B. Strong emotions like laughter can trigger my symptoms. C. Alcohol and caffeine have no impact on my condition. D. Getting enough sleep at night can help reduce episodes. Answer: C. Alcohol and caffeine have no impact on my condition. Question 14. A patient with narcolepsy is being evaluated for safe discharge. What is the most important assessment before allowing the patient to leave? A. The patient has arranged for a ride home. B. The patient understands the use of stimulant medications. C. The patient demonstrates knowledge of fall prevention. D. The patient verbalizes the need for good sleep hygiene. Answer: A. The patient has arranged for a ride home. Question 15. A nurse is prioritizing care for a patient with narcolepsy. Which is the highest priority? A. Educating about coping mechanisms. B. Administering prescribed stimulants. C. Preventing injury from sudden sleep episodes. D. Teaching relaxation techniques. Answer: C. Preventing injury from sudden sleep episodes. Question 16. The nurse should emphasize which safety measure for a patient with narcolepsy? A. Avoid driving unless cleared by your provider. B. Increase fluid intake before bedtime. C. Sleep longer on weekends to catch up on rest. D. Only take prescribed medications when symptoms occur. Answer: A. Avoid driving unless cleared by your provider. Question 17. What is the primary characteristic of narcolepsy? A. Insomnia. B. Excessive daytime sleepiness. C. Restless legs at night. D. Sleep apnea. Answer: B. Excessive daytime sleepiness. Question 18. A nurse is educating a patient with narcolepsy on non-pharmacologic interventions. What should be included? A. Take scheduled naps throughout the day. B. Increase alcohol intake to improve sleep. C. Ignore excessive daytime sleepiness. D. Avoid exercising during the day. Answer: A. Take scheduled naps throughout the day. Question 19. Which symptom differentiates narcolepsy from other sleep disorders? A. Insomnia. B. Hypersomnia. C. Cataplexy. D. Snoring. Answer: C. Cataplexy. Question 20. A nurse is assessing a patient with suspected narcolepsy. Which diagnostic test is commonly used? A. Polysomnography. B. MRI scan. C. EEG. D. CT scan. Answer: A. Polysomnography. Question 21. A nurse is reviewing a patient's medication list. Which prescribed medication would require further questioning for a patient with narcolepsy? A. Modafinil. B. Sodium oxybate. C. Diphenhydramine. D. Methylphenidate. Answer: C. Diphenhydramine. Question 22. A patient with narcolepsy is prescribed a central nervous system stimulant. Which side effect should the nurse monitor for? A. Bradycardia. B. Increased blood pressure. C. Excessive sedation. D. Hyperglycemia. Answer: B. Increased blood pressure. Question 23. Which behavior requires intervention for a patient with narcolepsy? A. Taking scheduled naps. B. Drinking a glass of wine before bed. C. Using a CPAP machine at night. D. Wearing a medical alert bracelet. Answer: B. Drinking a glass of wine before bed. Question 24. A patient with narcolepsy is admitted to the hospital. What is the most important nursing intervention? A. Keeping lights on in the room. B. Allowing naps as needed. C. Placing the bed in the lowest position. D. Encouraging long daytime rest periods. Answer: C. Placing the bed in the lowest position. Question 25. A nurse is assessing a patient suspected of having narcolepsy. Which patient report supports the diagnosis? A. I wake up multiple times during the night. B. I feel refreshed after sleeping for a short period. C. I have trouble falling asleep at night. D. I experience trouble breathing during sleep. Answer B. I feel refreshed after sleeping for a short period. Question 26. A nurse is teaching a patient about narcolepsy. Which statement indicates the patient understands the condition? A. This condition only affects older adults. B. I should take my stimulant medication in the evening. C. Narcolepsy is caused by a lack of hypocretin in the brain. D. Narcolepsy symptoms can be completely cured with medication. Answer C. Narcolepsy is caused by a lack of hypocretin in the brain. Question 27. A patient with narcolepsy is concerned about workplace safety. What is the best nursing advice? A. You should inform your employer about your condition. B. Avoid working any type of job. C. Take an extra dose of medication before work. D. Shift work is ideal for people with narcolepsy. Answer A. You should inform your employer about your condition. Question 28. Which dietary modification is most appropriate for a patient with narcolepsy? A. Increase carbohydrate intake. B. Avoid large meals before important activities. C. Drink alcohol before bed to improve sleep. D. Eliminate all sources of caffeine. Answer B. Avoid large meals before important activities. Question 29. The nurse is evaluating a patient's understanding of narcolepsy self-management. Which statement requires correction? A. I should avoid prolonged periods of inactivity. B. Regular exercise can help manage symptoms. C. Sleeping longer at night will eliminate daytime sleepiness. D. I need to establish a consistent sleep schedule. Answer C. Sleeping longer at night will eliminate daytime sleepiness. Question 30. A patient is undergoing a multiple sleep latency test, MSLT. What is the purpose of this test? A. To detect airway obstruction. B. To assess how quickly the patient falls asleep. C. To evaluate brain activity during sleep. D. To measure muscle strength. Answer B. To assess how quickly the patient falls asleep. Question 31. Which safety concern is most important to address for a school-age child with narcolepsy? A. Managing classroom behavior. B. Preventing injuries during physical activities. C. Monitoring caffeine intake. D. Encouraging social interactions. Answer B. Preventing injuries during physical activities. Question 32. A nurse is teaching a patient with narcolepsy about medication use. Which statement requires further teaching? A. I should take my medication at the same time every day. B. If I miss a dose, I should double my next dose. C. I need to avoid alcohol while on this medication. D. Some medications may cause appetite suppression. Answer B. If I miss a dose, I should double my next dose. Question 33. The nurse is assessing a patient suspected of having narcolepsy. What finding is most concerning? A. The patient reports excessive daytime sleepiness. B. The patient experiences temporary paralysis upon waking. C. The patient falls asleep while cooking. D. The patient has vivid dreams. Answer C. The patient falls asleep while cooking. Question 34. A nurse is teaching about the effects of narcolepsy. Which symptom is most characteristic of the condition? A. Frequent nightmares. B. Muscle weakness triggered by emotions. C. Chronic difficulty falling asleep. D. Sudden movements during sleep. Answer B. Muscle weakness triggered by emotions. Question 35. A patient with narcolepsy is starting sodium oxybate therapy. What is the most important instruction? A. Take this medication first thing in the morning. B. Avoid taking this medication with alcohol or other sedatives. C. This medication should be taken with a full meal. D. You may stop this medication suddenly if side effects occur. Answer B. Avoid taking this medication with alcohol or other sedatives. Question 36. A patient with narcolepsy is prescribed a wakefulness-promoting agent. What is the expected outcome of this medication? A. Decreased nighttime sleep. B. Reduced daytime sleep attacks. C. Increased total sleep hours. D. Complete elimination of narcolepsy symptoms. Answer: B. Reduced daytime sleep attacks. Question 37. A patient with narcolepsy is at risk for social isolation. What nursing intervention is most appropriate? A. Encourage participation in support groups. B. Recommend avoiding public outings. C. Suggest complete rest throughout the day. D. Discourage discussing the condition with others. Answer: A. Encourage participation in support groups. Question 38. Which statement by a patient with narcolepsy indicates a misconception about the condition? A. My symptoms are lifelong, but they can be managed. B. Narcolepsy is a psychological disorder. C. Regular naps can help control daytime sleepiness. D. I need to be cautious with activities that require alertness. Answer B. Narcolepsy is a psychological disorder. Question 39. A patient is concerned about the long-term effects of narcolepsy. What is the best nursing response? A. Narcolepsy does not affect life expectancy. B. Your symptoms will gradually go away over time. C. This condition will eventually lead to complete insomnia. D. Narcolepsy will significantly shorten your lifespan. Answer: A. Narcolepsy does not affect life expectancy. Question 40. Which nursing diagnosis is most appropriate for a patient with narcolepsy? A. Risk for injury. B. Impaired gas exchange. C. Chronic pain. D. Deficient fluid volume. Answer: A. Risk for injury. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.